Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. So now let us have a little recap of what we have done in part 1. As you know, PCOD refers to Polycystic Ovarian Disease. So disease is something that is very particular to a certain organ, right? And here in PCOD, we have immature follicles which are formed into smaller cysts. And the number of cysts and the size of the cyst in PCOD is very less compared to PCOS. So what is PCOS? PCOS is Polycystic Ovarian Syndrome. When we are mentioning the word syndrome, it means that it affects more than one organ. Here, many organs are affected in PCOS, and we will get to know about them in detail as we go further in the video. So PCOD, the main purpose or the main pathology runs where the hormones are disrupted. It is mild in nature, the hormones are disrupted, and the hormones are estrogen and progesterone. Whereas if you see PCOS, there is hormonal disruption. Along with that, there is excess of androgen, that is testosterone, in the female body. If you see about the hormones, the main difference is in the PCOD there is estrogen progesterone difference or imbalance. As we can say here in PCOS, there's a lot of difference, like luteinizing hormone is more, the FSH is less, the progesterone is less, the estrogen can be divided into E1 and E2. E2 is less, E1 is more, and then we have this prolactin. Some people we have hyperprolactinemia. So it's hard to remember. So how do you differentiate? This has a lot of estrogen and progesterone difference, whereas PCOD has a lot of androgen hormone, that is testosterone is increased. That is the basic difference that you can differentiate between PCOS and PCOD. If you're someone who doesn't know if you're suffering from PCOS or PCOD, even after seeing this complete video, just get an androgen test done and check your serum level. If it is more in nature, then you can finalize it as PCOS. Then coming to the menstrual cycle differences between PCOD and PCOS. In PCOD, you will understand that the menses are irregular or they can be delayed. Many patients come to us complaining we have irregular periods, and when we ask in detail, remember that the homeopathic case taking is very different from allopathic or conventional form of case taking, right? So in homeopathy, we give attention to every detail that you're mentioning it to us. So if you're someone who's saying like I have irregular periods, we will ask you when was your last period, and then how is your cycle, is it irregular or is it late? There is a vast difference between having an irregular period and having a late period, right? So what is the difference? For example, if you're someone who's suffering from periods which are delayed, like your cycle is 45 days, sometimes your cycle is 50 days, sometimes your cycle is 60 days, but you see the pattern repeating, that is every 60 days or 60 to 65 days or every 40 to 45 days, every 30 to 35 days, you're having the period regularly. Although it is late, you're having it at a regular period. So that is called periodically late period, which is a characteristic of PCOD. And in PCOS, if we see, we have irregular period. What do you mean by irregular period? Sometimes your period cycle is 10 days. And sometimes many people feel that if they have PCOS, they will not be having proper bleeding, or the bleeding will be very scanty. Remember, PCOS presents in different manners. We had a patient who walked into our clinic, and she was complaining about periods, that is menstruation, frequently for every 10 days it is being repeated. So what would you guess as a doctor? It should be either bulky uterus, or she should be having fibroids or endometriosis. You should be guessing all of these stuff, right? But when we got a scan done, it was PCOD, and there is no bulky uterus, endometrial thickness is good, and even there are no fibroids also. See, PCOS presents itself in different manner. But the cycle period, if you see in PCOD, the cycle period usually, although late, it is a little bit regular in nature, even if it is late. If you take PCOS, it is very irregular. Sometimes you'll be having period cycle for 10 days, and then you'll start your menstruation, and then after 1 or 2 months you'll get your period, and then again after 10 days you might be getting your period, or 20 days, or 6 months, or sometimes there is no period at all for 6 to 8 months. That is a period of secondary amenorrhea. That is what we call in medical language. That is, you're not getting your period for a period of 6 to 8 months also. There is no sign of your period, and then it suddenly appears. So there is no regularity in that. That is called as an irregular period. So that is characteristic of PCOS, right? So PCOD, although it is late, it can be a little bit regular, but PCOS is very, very irregular in nature. Coming to the consultation options, here we have seen why homeopathy is important. How we have seen homeopathy is much better than allopathic form of treatment, and in homeopathic form of treatment, we suggest you to choose Fidicus Homeopathy. At Fidicus Homeopathy, we have two kinds of consultation options. One is online consultation, the other one is offline. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying away from us and you would like to get in touch with us, you can call us either to audio call or you can connect us to the video call. After the doctor consultation has taken place, we will be asking you for investigations, and once the investigations are reviewed, especially to the online clients, we will be sending you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and if you're staying across the globe anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're someone who's experiencing PCOD or PCOS or any female reproductive organ diseases, you can contact us on this number, which is given here. You can call us, you can WhatsApp us, or you can message us on this number. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's experiencing PCOD, PCOS, or any female reproductive organ diseases, try choosing Fidicus Homeopathy. Why is Fidicus Homeopathy much better option? We have seen how homeopathy is much better option than allopathy. Now we are going to tell you how Fidicus Homeopathy is much better option than any other homeopathic clinic. Because Fidicus Homeopathy stands for highest chance of health. Here we have already having good or high success rate with people who are suffering from PCOD, PCOS, endometriosis, adenomyosis, bulky uterus, and fibroids. Apart from that, we have transparent treatment, which is there is no gray area between the patient and the doctor. We will be clearly telling you about your prognosis. And the third thing, the personal care here at Fidicus is top notch. The reason why we are doing the video is because we are having a lot of patients who are asking a different questions. So we just thought, like, if the patient who is coming to us is asking these many questions, what if some people who are not expressing how they are feeling or what they have and they do not even know if they're suffering from certain diseases. So we wanted to do educational videos on that. So we are doing these videos based on the personal experience we have had with our patients. So here at Fidicus, the personal care is top notch. Even if you're having some sort of queries or if you're having any sort of doubts, we will be clearing that to you. So if you want to choose health, if you want to choose proper cure for your diseases, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.